Welcome to WJRDoctors.com, Southeast Michigan's distinguished doctors.
Dr. Lewis in Radden. The location of my practice is 32270 Telegraph Road, Suite 110, Bingham Farms, Michigan, 48025. Well, number one, they know that we're going to always try a conservative approach with their patient. They feel very comfortable, the patients feel comfortable at Spine Specialists of Michigan because, again, we go over the patient's conditions with them, we go over their MRIs, CAT scans, and any other imaging studies that they have. And again, we have a conservative approach. For one, at Spine Specialists of Michigan, we take a comprehensive approach to the patient. We take a more conservative approach. This would include offering services such as physical therapy, chiropractic care, aquatic therapy, as well as pain management. Pain management procedures would include things like nerve blocks or epidural steroid injections, kyphoplasty, which just means that if a patient has a fracture, they don't have to wear a brace for 12 weeks. We can perform a 30-minute procedure where we're able to restore the architecture of that fractured bone within the spine, and we help support that with cement, and that also helps to reduce the pain in that particular patient. Pain management is basically, it's a minimally invasive approach to reducing the patient's pain. Patients that I see on a daily basis typically will present with me complaining of neck pain, pain radiating into the upper extremity, or low back pain radiating into the lower extremity. Typically these symptoms are caused by a nerve root that becomes inflamed. The nerve root becomes inflamed secondary to a disc, which is typically touching or coming in close proximity to the nerve. In addition, the contents of the disc can leak around the nerve, causing inflammation and pain in the patient. Pain management is a minimally invasive approach where we can use fluoroscopic guidance imaging, where we can locate and isolate a nerve, and then at that point we can place medications around the nerve to decrease the inflammation around the nerve and the disc. So in this particular instance, this is a lumbar spine model. The yellow structure shows the actual nerve root. The vanilla structure or beige structure shows the disc. And as you can see, there's a close proximity to the nerve and the disc. And it's very typical for patients that I see on a daily basis to have an inflamed nerve root. Our goal is to decrease the pain in the patient, decrease the subjective complaints by placing medications which typically include a steroid as well as a long-acting anesthetic like Marcaine, and it helps to decrease the inflammation around the nerve and the disc. Well, I think that's because, number one, I always talk about a less invasive approach with my patient. Surgery is always the last resort for my patients. So we'll try things like rehab, aquatic therapy, chiropractic care, and the nerve blocks, the pain management aspect of it. If the patient fails conservative care, then at that time we'll recommend surgery. Well, number one, new on the horizon for spine specialists is laser spine surgery, also artificial disc replacement for both the cervical spine and lumbar spine. These technologies, particularly in terms of artificial disc replacement, these are not brand new technologies, but the insurance companies were not paying for these particular types of treatments back in 2005. Now they're getting on the formularies for a lot of insurance companies, so we'll be able to offer these services to our patients. So we won't only have the traditional decompression surgery or fusion surgery, but now we have other surgeries, which would include motion preservation surgery. Well, number one, the best things in terms of diagnosing patients' conditions would include an MRI. An MRI is a three-dimensional study. It's so precise, we're able to find specifically certain conditions that would cause your back or neck pain. These would include any issues with the disc, any issues with the nerve, whether or not the nerve is swollen, and we can see these types of pathologies on that three-dimensional study. Number two, the latest technology that we have is, number one, robotic spine surgery, where we're able to perform robotic spine surgery utilizing less invasive techniques, less blood loss. Patients are up walking the next day. They're typically out of the hospital within 24 to 48 hours. And the most important thing is that they get maximum pain relief. If you are a new potential patient, again, we start off with conservative measures. Number one, I like to start off by listening to the patient, understanding your subjective complaints, meaning what ails you, what's bothering you. Is it your neck and arm pain? Is it your back and leg pain? From there, we'll order diagnostic studies, which would include an MRI. Again, it's a three-dimensional film. We're able to identify any type of pressure on the nerve or nerve sac, or any type of pressure on the spinal cord. Once we're able to identify the pathology, we'll address it appropriately, typically with something that's less invasive, which would include physical therapy, chiropractic care, aquatic therapy, and possible pain management procedures. As a last resort, we discuss surgical solutions. If you want to schedule an appointment, you can go to ZocDoc.com. Number two, you can go to SpineMI.com to view our website, schedule an appointment through the website. In addition, you can make a phone call to Spine Specialists in Michigan. That number is 248-792-9496.